بسم این تبادل روزه 1399 مبارک. Hi friends, I want to mention some more contents about coronavirus. First, we need to know what it is. We can overcome it when we have enough information about coronavirus. 7 different types of this virus have been identified so far, ranging from colds, more severe symptoms disease like H-week SARS, H-week MERS, and more recently COVID-19. The first report of coronavirus disease were in 1960 included H-229E and H-OC43. H-OC43 were identified in 2004 and H-HKU1 were identified in 2005, mostly due to colds and in children, and people with underlying disease. It can cause LRT or lower respiratory tract infection. Please look at these pictures. Corona in this language means corona inspired by the outward formation appearance of the virus. Viral infection form of the virus can be seen under the electron microscope in the form of a royal cone. For this reason, calling it coronavirus. The World Health Organization announced in February 2020 that COVID-19 is the official name of this disease. World Health Organization Chief Tedros Adhanom explained that CO stands for corona, viral for virus, and D for disease. COVID-19 is for the year that the outbreak was first identified, 30 December 2019. The name had been chosen to avoid references to a specific geographical location, i.e. China, animal species, or group of people in line with international recommendation for naming email as preventing stigmatization. Please look at this chart. According to statistics, Wikipedia, the Free Encyclopedia, and the two that causes, we can understand some points. Although the H-MERS have a 34 to 37% fatality rate, nevertheless that causes 912 human deaths, but the H-19 that a little viral genesis lapsed that caused 2362 human deaths until 22nd February. Nevertheless, H-19 have 2 to 3.11% fatality rate according to the top chart. It means H-19 just could very high virulence. In fact, the reason for the high number of deaths is that the virus is spreading at a high speed. So we need to prevent more people from getting infected, which is to reduce the population of patients. We need to focus on the same thing to reduce the number of deaths. What do you think we should do? I think I still need more information. At first, I want to prevent my respiratory droplets coming into the environment. Please look at this chart too. Please look at these pictures.
Infection begins when the virus enters the host organism and the spike protein attaches to its complementary host cell receptor. After attachment, a protease of the host cell cleaves and activates the receptor-attached spike protein. Depending on the host cell protease available, cleavage and activation allows cell entry through endocytosis or direct fusion of the viral envelope with the host membrane. 1. With their S protein. Coronavirus bind on cell surface molecules such as the metalloprotease aminopeptidase N viruses, which accessorily have the key protein. Can also bind on an acetyluramidic acid that serves as a co-receptor. 2. So far, it is not clear whether the virus gets into the host cell by fusion of viral and cell membrane or by receptor-mediated endocytosis in that the virus is incorporated via an endosome, which is subsequently acidified by proton pumps. In that clause, the virus have to directly produce their proteins and new genomes in the cytoplasm. At first, the virus synthesizes RNA polymerase that only recognizes and produces viral RNAs. This enzyme synthesizes the minus strand using the positive strand as template. 4. Subsequently, this negative strand serves as template to transcribe smaller subgenomic positive RNAs which are used to synthesize all other proteins. Furthermore, this negative strand serves for replication of new positive strand RNA genomes. 5. The protein then binds genomic RNA and the protein now is integrated into the membrane of the endoplasmatic reticulum, like the envelope protein S and P. After binding, assembled nucleocapsids with helical twisted RNA bud into the lumen and are encased with its membrane. 6. These viral progeny are finally transported by Golgi vesicles to the cell membrane and are exocytosed into the extracellular space.
Due to the type of coronavirus, symptoms can vary, including colds, fever, dry cough, respiratory distress, fatigue, and muscle pain, and acute respiratory failure. HCOV MERS, unlike the HCOV SARS, except the respiratory system involved in other vital organs like the kidney and liver. In addition, in acute cases, gastrointestinal problems such as diarrhea, acute respiratory failure, blood coagulation disorder, and renal failure has been reported. The patient may eventually require hemodialysis. According to research and statistics, the incubation period of the virus is 2 to 14 days, and symptoms of this disease: fever 43.8% when accepting, 88.7% when admitted, dry cough 67.8%, sputum production 32.4%, fatigue 38.1%, shortness of breath 18.6%, diarrhea 2.7 to 31%, headache 13.6%, chill 11.4%, sore throat 13.9%, loss of smell 30 to 66%, nausea or vomiting 5%, nasal congestion 4.8%, hemoptysis 0.9%, conjunctival congestion 0.8%, muscle or joint pain 11% to 14%, command. On average, according to statistics, incubation period is typically 5 to 6 days. 97.5% of people who develop symptoms will lose weight in 11.5 days of infection. Ground glass opacity in chest CT scan visible at 56.4%, patients with non-severe disease 17.9%, patients with serious symptoms 2.9%, they have no problem on radiology. Lymphocytopenia or decreased condition of lymphocytes in the blood 82.2% when accepting, severe fear and stress followed by cortisol release from factors that impair the immune system. Concerns have been raised above long-term sequelae of the disease. The Hong Kong Hospital Authority found a drop of 20% to 30% in lung capacity in some people who recovered from the disease, and lung scans suggest organ damage. Typical CT imaging findings: CT imaging of rapid progression stage. Some people have no symptoms or have only mild symptoms, but in others, COVID-19 can lead to more serious problems such as pneumonia, decreased or inadequate oxygen intake, and even death. Some people become infected but don't develop any symptoms and don't feel unwell. Most people, above 80%, recover from the disease without needing a special treatment. Around one out of every 6 people who gets COVID-19 becomes serious and develops difficulty breathing. Older people and those with underlying medical problems like high blood pressure, heart problems, or diabetes are more likely to develop serious illness. People with fever, cough, and difficulty breathing should seek medical attention. Therefore, even if we have no symptoms, we need to care for our dears. Human-to-human transmission of coronaviruses is primarily thought to occur among close contacts via respiratory droplets generated by sneezing by coughing. People can catch COVID-19 from others who have the virus. The disease can spread from person to person through small droplets from the nose or mouth, which are spread when a person with COVID-19 coughs. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching these objects or surfaces, then touching their eyes, nose, or mouth. Estimation of the rate of decay with a Bayesian regression model suggests that virus may remain viable up to 18 hours on copper, 55H on cardboard, 90H on stainless steel, and over 100 hours on plastic. The virus remained viable in aerosols throughout the time of the experiment TH. The virus has also been found in feces, and transmission throughout feces is being researched. People can also catch COVID-19 if they breathe in droplets from a person with COVID-19 who coughs out or exhales droplets. It is primarily spread between people via respiratory droplets from cough and sneeze. This is why it's important to stay more than 1 meter 3 feet away from a person who is sick. Standard recommendation to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing. Please take a look at some tips that the WHO remind us to protect yourself. Protection measures for everyone. Stay aware of the latest information on the COVID-19 outbreak available on the WHO website through your national and local public health authority. Many countries around the world have seen cases of COVID-19 and several have seen outbreaks. Authorities in China and some other countries have succeeded in slowing or stopping their outbreaks. However, the situation is unpredictable, so check regularly for the latest news. Preventive measures to reduce the chances of infection include staying at home, avoiding crowded places, washing hands with soap and warm water often and for at least 20 seconds, practicing good respiratory hygiene and avoiding touching the eyes, nose, or mouth with unwashed hands. The CDC recommends covering the mouth and nose with a tissue when coughing or sneezing, or using inside of the elbow if no tissue is available. They also recommend proper hand hygiene after any cough or sneeze. Social distance strategies aim to reduce contact of infected persons with large groups by closing schools and workplaces, restricting travel, and canceling mass gatherings. Social distance also include the people stay at least 6 feet apart above 1.80 meters. You can reduce your chances of being infected or spreading COVID-19 by taking some simple precautions. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. Why? Washing your hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. Maintain at least 6 feet apart above 1.80 meters distance between yourself and anyone who is coughing or sneezing. Why? When someone coughs or sneezes, They spray small liquid droplets from their nose or mouth which may contain virus. If you are too close, you can breathe in the droplets, including the COVID-19 virus if the person coughing has the disease. Avoid touching eyes, nose, and mouth. Why? Hands touch many surfaces and can pick up viruses once contaminated. Hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and can make you sick. Make sure you and the people around you follow a good respiratory hygiene. This means covering your mouth or nose with your bent elbow or t-shirt when you cough or sneeze. Then dispose of the used tissue immediately. Why droplets spread virus? By following good respiratory hygiene, you protect the people around you from viruses such as cold, flu, and COVID-19. Stay home if you feel unwell. If you have a fever, cough, and difficulty breathing, seek medical attention and call in advance. Follow the direction of your local health authority. While national and local authorities will have the most up-to-date information on the situation in your area. Call in advance will allow your health care provider to quickly direct you to the right health facility. This will also protect you and help prevent spread of viruses and other infections. Keep up to date on the latest COVID-19 hospitals, cities, or local areas where COVID-19 is spreading widely. If possible, avoid traveling to places, especially if you are an older person or have diabetes, heart or lung disease. Why? You have a higher chance of catching COVID-19 in one of these areas. Protection measures for persons who are in or have recently visited past 14 days. Areas where COVID-19 is spreading. Follow the guidance outlined about protection measures for everyone. Self-isolate by staying at home if you begin to feel unwell. Even with mild symptoms such as headache, low-grade fever, 37.2 degrees Celsius or above, and a slight runny nose until you recover. If it is essential for you to have someone bring you supplies or to go out, e.g. to buy food, then wear a mask to avoid infecting other people. Why? Avoiding contact with others and visits to medical facilities will allow these facilities to operate more effectively and help protect you and others from possible COVID-19 and other viruses. If you develop fever, cough, and difficulty breathing, seek medical advice promptly, as this may be due to respiratory infection or other serious condition. Call in advance and tell your provider of any recent travel or contact with travelers. While calling in advance will allow your health care provider to quickly direct you to the right health facility. This will also help to prevent possible spread of COVID-19 and other viruses. Can I catch COVID-19 from the feces of someone with the disease? The risk of catching COVID-19 from the feces of infected person appears to be low, while initial investigations suggest the virus may be present in feces in some cases. This route is not a main feature of the outbreak. WHO is assessing ongoing research on the ways COVID-19 is spread and will continue to share new findings because this is a risk. However, it is another reason to clean hands regularly after using the bathroom and before eating. According to the WHO, the use of masks is recommended only if a person is coughing or sneezing or when one is taking care of someone with a suspected infection. Some countries also recommended healthy individuals to wear face masks, particularly China, Hong Kong, and Thailand. Some health experts consider wearing non-medical grade masks and other face coverings like scarves or bandanas. A good way to prevent people from touching their mouths and noses, even if non-medical coverings would not protect against a direct sneeze or cough from an infected person. We now understand the nature of the coronavirus, how it enters the hospital, how it transmits the disease, how it affects in the person, and what are symptoms and effects on the body. So we should avoid viruses now and penetrate it if possible 1%. We need to control the virus in our body and be able to defeat the virus and symptoms without fear and confusion.